Hi again. Now we have come to the last topic of our MC course. We will be discussing about the strategies for preventions of falls. So if we were to reflect what we have learned earlier, we have been we have discussed the aging of the populations, the consequences of the aging of the populations. We have learned to understand uh, falls among older people. We have learned what are the risk factors of falls in older people, and we have learned how to screen or how to pre-screen older people for risk of falls. Okay, now if we have known that someone is having a risk of fall or high risk of falls, now it is time for us to do preventions. Okay, to prevent falls among the older persons, we need to do something about the factors that can lead to falling. Okay, so these are the contents of today's topic. We will look at the expected learning outcomes, some terminologies, ways to reduce risk of falling, precautions for safety before starting an exercise program. We will briefly look at some of the exercises, um, and towards the end, we will summarize the key points of what we learned today. So, what is expected as the learning outcomes at the end of this topic? You should be able to determine the safety of the home environment, and you should be able to identify home hazards that can cause falling. You should be able to perform or conduct exercise program for improving balance, performance, and muscle functions among the older persons that can actually reduce risk of falls. Okay, some of the terminologies that you may encounter in this topic: exercise program, intervention, prevention, home safety, and exercise. So what is exercise program? Exercise program is a type of program that consists of a variety of physical exercises performed over a set period of time, and are usually adjusted to the needs of the individuals. So it may means that and exercise prescriptions can be we can adjust the prescriptions according to the ability of the older persons, and we can also progress the intensity of the exercise. Okay, now intervention. So what is intervention? Intervention refers to actions or sort of treatment that taken to improve illness and medical disorders. Okay, for the purpose of preventions of falls, so we refer interventions as treatment or strategies that can be taken to reduce the risk of falling or to improve the physical functions of the older persons. The next term is prevention. It refers to the actions of stopping or hinder something from happening or arising. Next is home safety. Home safety, referring to this topic, is the knowledge and educations about the risks and possible dangers that exist in and around the home that could cause harm or injury to a person. And lastly, the term exercise is a type of physical activity that is more structured, repeated, and has a specific goal. So when we do exercise, we must have some purpose. So, ways to reduce risk of falling. You have previously known about the various risks that can cause you to fall. You have also figured out if you are at risk of falling incidents. Did you know that many of these factors can actually be modified or controlled? Yes. So, preventions of falls. Based on a number of modifiable factors, a number of steps can be taken to reduce the risk of falling, including reduce hazards due to the environment and promoting exercise to increase the strength and balance of the body. So there are two major interventions here, which regards to the role of physiotherapists. Okay, so my intention is to introduce the importance of reducing hazard that is related to the environment or to the home environment or outside the house, and also to promote the importance of exercise to increase strength and improve balance performance. Okay, now with regards to environmental hazards, okay, so what can we do to the environment? What can we do to the hazards that can be found in the surrounding environment? Okay, so keep the home environment away from any hazards. For example, objects on the floor that can cause someone to step on or tripping the hazards. Uh, Use suitable lighting or secure staircases and install barriers or handles is important in the area that is important, such as the staircase where the elderly normally have to they use staircase to go up and down, the toilets, the rooms or the bedrooms, and the kitchens. Okay, so these are the area that we can consider them that they frequently visits or use, right? The equipment often used by senior citizens or elderly should be safe to use. For example, make sure they sit on stable and motionless chairs. Avoid the use of lightweight plastic chairs as they are easily slip, and make sure wooden chairs do not rot. Okay, so a stable furniture so that they will be sitting in a stable positions uh, to prevent falling. Okay, so remove carpets or floor pedestal from the living room. It is best not to use the carpet because if they are senior citizens in the living room or in the house, they can just slip or trip on it and they fall. If you still need to use carpet, then make sure the edges of the carpet do not fall. Remove furniture or objects on the floor. Reduce the use of small furniture on the floor. Sometimes some people they like to put miniatures on the floor, vessels that can be an obstacle to the elderly. Sometimes they couldn't see it because of their poor visions, and then they will trip on it and they fall. Make sure that no wires or ropes connecting electrical appliances are located on the floor. Remove any objects that may interfere with movement in the living room, bedroom, bathroom, and in the kitchen. Make sure the color and intensity of the lights are suitable, especially at night, in walking spaces, uh, such as the way to the toilet. Attach the holder to the ladder. Switch seats or sofas that are too low, that it makes them difficult for them to sit down and get up, and especially when they try to get up, uh, they couldn't balance their body and they might fall. Make sure the floor is not washed or rinsed with washing materials that cause the floor to be slippery, especially immediately after washing or mopping the floor. Make sure the phone is placed at a height level that is easily reached when the senior citizens or when the elderly falls to the floor and they want to try to reach the phone. They should be able to reach them easily to call for any helps or to inform the family about her or his falls incidents. Pair the bar or holder close to the bath or bathtub and adjacent to the toilet, so that they can use both hands to control their movement or to balance when they feel like falling down. The appropriate toilet for senior citizens is a sitting toilet. So um, sometimes you may have to change or modify toilets if you are using the squatting toilet. Make sure the toilet floor and bathroom are always dry, because a wet floor is slippery and will cause harm to the elderly. Use a floor mat from rubber that is not slippery if necessary. Fix broken or uneven floors. So make sure that the floors is even, because sometimes when you walk, they couldn't really appreciate, or they couldn't figure out the depth of the floor, and they may misstep and then fall. Pair the holder bar on places where there is a ladder or area that they need to step. Okay, so left and right, so that it is easy for them to hold on the bars or the handles. Make sure the grass or plants, trees are cut short so as not to hinder the walking space. Make sure the lights are installed throughout the walking room to get to the door. Okay, now medications. What can we do about medications? How can we deal with if the cause of the fall is due to polypharmacy or multi-medications, polymedications? What can we do about it? Okay, so you know that rising age will also increase the susceptibility to various diseases, and this may cause us to take many medications. So to make sure that we can identify any side effects of these drugs that may increase the risk of falling. If you feel that taking the medicine is causing various effects such as dizziness, nausea, loss of balance, drowsiness, weakness, and many other signs or symptoms, then you should seek advice from the doctor or pharmacist. Vision and hearing examinations. So older people should perform a regular eye and hearing examinations. You're advised to have regular eye exams, and especially if you use vision and hearing aids. If you use glasses, you need to make sure it suits the level of vision to ensure good vision, especially in dangerous places such as in the stairway area. Seniors with vision problems sometimes cannot be sure of the height of the stairs, causing them to fall. As for hearing aids, keep the battery in good conditions all the time. Always see the doctor and your physiotherapist for periodic checkups. You are encouraged to see a doctor and physiotherapist regularly, especially if you have ever fallen due to loss of balance. The risk of falling increases with increased age. The more you age, the more often you need to see a doctor and physiotherapist. Involve all family members, communities in increasing involvement in social activities. Family members should be concerned about the presence of senior citizens in the same house and not just leave them alone. Seniors who are confined to home or living alone indoors are more likely to suffer from depressions, causing less movement that eventually lead to weak body syndrome or frailty. This increases the risk of falling. Therefore, family members need to involve the elderly in their daily activities so that they feel more valued and thus maintain a good quality of life. Okay, let's look at some of the risk of fall safety measures. Get help if needed to get up, sit or walk. You can easily call anyone around you to assist you. Do not use shoes or slippers whose soles are smooth or have been eroded. Do not use narrow shoes or shoes with inappropriate heels or very tight shoes. Prepare a chair with hand support with the key on the wheel near the bed if necessary. Make sure there are no obstacles to walking to the walking area, to the living room, or to the bathroom, or to the kitchen. Keep the aids running. Is always placed the near you or places that are easy to reach. If sleeping in a hospital bed, make sure that the side restraints are raised during sleep. Ensure the positions of the bed control, emergency belt, and any form of support is easy to reach. Make sure the height of the bed and the chair suits your height as well. You should be also concerned about the peak effect of the medications taken, which can cause side effects. And if you are taking too many medications at one time, that can cause you some of these adverse effects, you may discuss this with your doctor. Make sure your environment is safe before starting any movement, walking, or any physical activity. Remove any obstacles around you if you plan to do any movement. You have a very high risk of falling incidents, such as falling too often, relying too much on walking aids. It is difficult to get up from sitting, and many others. Make sure you are always with your caregivers. The caregivers should ensure that when you are moving while you are in bed, all the side barriers are in an elevated and locked position. For carers or caregivers, diligently get knowledge on or information about the care of the senior elderly who are very much at risk of falling. Carers and senior citizens can engage in discussion with other health disciplines in the care of those at risk of falls. All family members need to be trained on the caring for senior citizens who are at risk of falling. Okay, so now let's move on the strength and balance exercise. Okay, the ability of older adults to balance the body is the key to avoid or prevent falling incidents. Okay, so it is very important for them to be able to control the changes in the posture, especially during movement, so that they can prevent falling. So strength of the muscle is very important to be able to control the balance in a stable the body in a stable position. So most of the finding from previous studies or research conclude that the most effective exercises to improve body balance are resistance exercises and balance exercises. Okay, so balance exercises alone has been found to improve body balance. Resistance exercise, on the other hand, is not effective enough to reduce the risk of falls because body balance is the most major risk of falling incidents compared to muscle strength. Walking exercise alone was found to be insufficient to reduce the risk of falling. The maximum effect of exercise in reducing the risk of falls are balance exercises where the level of difficulty is always increased or progressed according to the level of ability. So here, the best exercise is a combination of strength and balance exercises. So, walking exercises are the safest, but if done at a normal speed may be less effective for fall prevention. Instead, walking exercises need to be varied and increase in difficulty to add to its effect. This can be done by progressively increasing the running speed. Do not forget adding length or distance of steps. Walking forward, backwards, sideways, walking while adding weights or on hands or feet, and many more. Okay, so what are the roles of physiotherapists in preventing fall? Physiotherapists are those who are trained and certified in ensuring that you can move comfortably, independently, and actively. A physiotherapist can assess your risk for falls and plan an appropriate program based on individual needs, which makes each exercise for an individual senior different or unique. So it means that um, the exercise need to be individualized. We cannot have the same 2% or 3% having the same problem. Okay, they normally have definitely will have different problems and they need different uh, type of exercise or different design of exercises. Okay, so physiotherapists will help you with strategies to improve balance and muscle strength of the body, to provide education on how to reduce the risk of falls, to plan a program or activities that suit your needs, to advise on maintaining safe features in the house, in your house, to teach and um, safe, to teach safety ways, safe ways, okay, to teach you the safe ways to get up in case you fall, and to teach you to keep moving actively. So get your exercise recommendations from your physiotherapist. So before you do exercises, whatever you do in this world, there will be some dangers, right? Some uh, benefits, but um, if you overdo, if you do it wrongly, you may also lead you to some harms. Even doing exercises can cause falls. So before starting any exercises, you need to know some of the safety features that need to be observed to avoid any injuries or complications as a result of exercising. So ensure that they are safe to exercise alone indoors or outdoors. If you have never or are not used to exercising, make sure you know your risks. Before exercising, you need to get advice from a doctor on whether it is safe for you to exercise and how safe exercises is. Your doctor will probably do some heart or some endurance tests to make sure it is safe for you to exercise. Do a warm-up exercise before starting the exercise and a cooling down exercise after finishing the exercise. Stretching exercises are done after doing warm-up exercises to loosen tight muscles so that movement is easier to avoid injury during the next exercise activities. Okay, so do not hold your breath while exercising. You have to breathe deeply as usual. Drink enough water before, after, and during exercise to avoid dehydrations, because when we exercise, usually we will sweat. Adequate water content in the blood also helps control blood pressure. While exercising, if you feel your pain is your chest is you're having chest pain, or you feel tight in the area of the chest, stop exercising and get adequate rest. If the pain persists, then you have to see the doctor immediately. When doing any exercise, make sure the body posture or body position is in the correct position to avoid muscle or joint injuries. If you have a history of heart disease, diabetes, or stroke, or any other chronic illness, seek advice from your doctor first prior to start an exercise program. Okay, so make it a practice to check your blood pressure before, during, and after exercises. So get a BP monitoring set and use the same one for your daily checkup. Okay, so this is the guide for your blood pressure reading that can guide you whether it is safe for you to do the exercises at that particular moment, or you can also use this as the guide for you to stop or to continue your exercises, or also to tell you that maybe you need to see the doctor prior to your exercising. Okay, so the guide here, if your blood pressure is below 90/60, your blood pressure is low, you are advised to consult the doctor before starting an exercise program. If your blood pressure is between 90/60 to 140/90, if your blood pressure is in this range, you are safe to do exercise. If your blood pressure is between 140/90 to 179/99, this blood pressure reading range is safe for light exercise, but should avoid heavy or high intensity exercise such as running and heavy weight exercises. If your blood pressure is between 180/100 and 199/109, this blood pressure is high, so you need to see and seek advice from a doctor. If your blood pressure is 200 and 110 and above, your blood pressure is very high. Do not do any physical activity. See your doctor immediately. So, precautions for safety before starting an exercise program. Okay, a physiotherapist and exercise specialist who is trained to give exercise recommendations to seniors who are at risk for falls. Your physiotherapist will plan an exercise prescriptions that is appropriate for your fitness level and safe to do if you have other disease conditions. Seniors who are at risk for falls need individual exercise prescriptions. This means the exercise needs may vary from persons to persons based on their physical ability and health conditions. So usually when you see a physiotherapist, they will conduct a detailed assessment to identify the current risk and fitness level. Then exercise prescription will be planned and will be constantly updated according to your achievement. Okay, so exercise recommendations for fall preventions among seniors living in the community or at home. Exercise must be done with increasing intensity from medium to high. This can be done in three ways: by reducing the base of support, moving the center of gravity, reduce the need of dependence on support, especially support using the upper limbs, Okay, so number 2, the exercise done should be sufficient dose to get a sufficient effect. The exercise should be done at least 2 hours a week or cumulative to 2 hours. Number 3, exercise should be done continuously. The positive effects of exercise will quickly disappear if exercise is stopped to or done irregularly. Number 4, the effect of exercise is better if you do not already have a high risk compared to those who present with a high risk of falling. Fall prevention exercises can be done in groups or at home alone or both. Number 6, walking exercise is also good and can be combined with body balance exercise because it is good for heart health. However, those who are at high risk of falling should avoid brisk walking. Resistance exercise or loads can be combined along with balance exercises. Effective resistance exercises increase the difficulty to the muscles so that the muscles can adapt. Make sure every time the right dose of exercise uh, to be given to the effect of exercise. If you give the right dosage, then your muscles can respond according to its functions. To ensure the correct dose, the load can be lifted 10 to 15 times before feeling tired. Elderly people who have risks that cannot be changed, they must take precautions such as vision pro medications intake, and the exercises need to be supervised or assisted by the relevant healthcare providers, and of course with the recommendations from the doctor or relevant specialist following a full examination. So before doing a heavy exercise, need to do some warm-up exercises. This is important to prepare the muscles of the body and prevent injury. The effects of warming up will increase blood flow to the muscles that will be used during exercise and cause the muscles to be more ready to work and stretch. You should do a warm-up exercise within 5 to 10 minutes. But if the exercise you want to do is heavy, such as brisk walking or running or resistance exercise, then it should be longer, about 10 to 15 minutes. Perform movements as if you were doing the same exercise movement such as walking or running locally. Move the muscles that you will be contracting or you will be moving during the exercise. Okay, so cool down exercises are just as important as warm-up exercises. It aims to return your body to rest or before exercising to prevent prolonged fatigue and helps the body recover. Avoid stopping immediately when the pulse is still high, the body temperature is still high, and the blood vessels are still dilated. Stopping abruptly will cause the heartbeat disturbance. Slow down the movement gradually by walking or running locally until the heart rate returns to low or below 100 beats per minute before doing the exercise or before stopping to rest. Do stretching exercises while the body is still hot or warmed, because at this time the muscle enjoys a warm and easy to stretch. Do stretching on large muscles such as hamstrings, quadriceps, biceps, triceps, gastrocnemius, and others. Exhale through the mouth while stretching the muscles and inhale through the nose slowly while holding the stretch. Perform easy stretch for 10 to 30 seconds for each joints or muscles, to 1 to 3 times for each muscle. So, there are various exercises that you can perform at home. Okay, so you can either do your exercise in the bed. You can do mobility exercises in sitting or standing. You can do resistance exercises with elastic or rubber band, or then you can progress, you can do progressive balance exercises. So these are some of the examples of exercises at home. You can read further the instructions. Hip flexor strength exercises, hip muscle strength exercises, and all these are exercises for the hip region, which is very important for controlling upright movement, upright standing, or sitting, walking. Okay, so it involves majority of these exercises are strengthening the muscles using your body weight as the resistance. And this is the mobility exercise in sitting and standing. Okay, you can do sit up, sit down, and sit up and sit again, and repeat this 10 to 15 times. Most of the exercises you have to repeat 10 to 15 times, rest in between sets. So you have to perform at least 3 sets. You can do marching or walking on the spot. Squatting exercises, if you are not sure, you can use the chair to support, for support. Hip side muscle strength exercises, hip extensor strength exercises. Okay, so these are the advantages. These are the next one, exercise C, resistance exercise with elastic rubber. The advantage of using elastic rubber for the elderly is that it is safer to use compared to heavy iron or heavy load, because the the tension is given by the rubber. Even if it falls on your leg, there is no load to the uh, there is no impact to the body part. Okay, so these are the examples of the exercises using the elastic band. Okay, knee extensions, or also known as leg press, lateral raise, squatting, chest press, biceps curl, seated calf press, hip abduction and extension. Okay, and this is the body balance exercise program or balance training. You are encouraged to do these exercises if you have done the exercises described earlier. You can also get advice from the physiotherapist on the need for this exercise. Remember, effective exercise should be done repeatedly, progressively, and continuously. Each movement should be repeated at least 10 to 15 times. For 3 sets, make sure you rest for 30 to 120 seconds between sets. Okay, so these are the balance training exercise of reaching the hands in a standing position, stepping up and down. You can use a low stool, walking exercises, tandem walk. You can walk backward walking, sideward walking, sit, stand and sit repeatedly, marching on the spot, standing on heel raises, squat while leaning against the wall. Do not bend the knees more than 90 degrees. Okay, so that's it. Some of the exercises. Okay, so let's summarize the key points that we have learned. There are many prevention strategies that could be taken in order to reduce the risk of falls, including the adjustments on the environments and involve actively in physical activity as well as exercise. So these are the two important key prevention strategies that highlighted in this topic. So both balance and strengthening exercises can be seen to be beneficial in reducing the risk of falls. Home exercises has been shown to be effective in reducing the risk of falls among low and moderate risk seniors or elderly. Safety measures and continual caution should be taken before doing exercise, especially to this vulnerable older people population. Incorporating warm-up and cool-down exercise are beneficial as it provides a lot of positive effects, including reducing the risk of injury. Okay, so that's it for now, and we shall be meeting again, okay, in the website, okay. So you will have to do some assessment that can be found in the website. Thank you very much.